How often do you see ruptured implants?
Not very often. We hear people talk about like that. You need to have them replaced every 10 years. But I've both been doing it now for 20 years, and I don't see, my patients coming back all the time with rupture. So I think the rupture rate's actually a lot lower than what the published rate is, which is like 25% at 10 years. I think it's probably more in the single digits.
Do you think it's an urgent thing? Patients come in very distressed, their implants ruptured, I need it out now. What's your thought on timing for that?
Yeah, I mean, these new ones are like cohesive, so that everybody's seen these cut in half a million times now. But I don't think it's an urgent thing. I think it's something that you can kind of wait. I think there's people who wait decades, quite honestly, who've had ruptured implants. But it can be an elective thing over the next few weeks or months, or when you get around to it, kind of thing.
And when I change out implants, I notice there's differences in older implants, like 1980s versus now. A lot of that has to do with the cohesivity or the thickness or the cross-linking of the gel. Older gels are much more liquidy and challenging to remove versus a newer gel, which tends to be more like a Jell-O. What are your thoughts?
Yeah, no, totally agree. I think that it's a spectrum from just a total disaster of goo everywhere to the newer implants sometimes almost come out all as one whole thing.